This is Raising.A.Dad.Solutions. I'm Robert, and I'm back talking to fathers about a topic that many never think about, but others do think about because they are living this experience. The title of the article that I'm about to examine is Why Would a Child or Adolescent Need Plastic Surgery? I want to give a big shout out to dailyherald.com. Also, fair use as I review this article. I'll leave a link to the article in the description box. Let's get to it. On his picture, on this image, is a little baby with what science calls a cleft lip, and it has the sentence at the bottom to describe it. Is a stock photo. A cleft lip is just one of many reasons why you may want to consult with a pediatric plastic surgeon. I am no way in shape, form, a doctor. I'm just a guy who's with the television production background uh, and trying to develop on YouTube by talking about issues that dads may be able to identify with. This article appears to have been published on December 31st, 2022. That was last year, you all. This is this year. Happy New Year. Sorry I didn't say that earlier. Looks like the writer is Dr. John Smetana. Hopefully I pronounced that right. Advocates Children's Hospital. Let's get to it. You may not associate the phrase plastic surgery with children, but pediatric plastic surgeons play a critical role in caring for children and adolescents with a wide range of conditions. Uh, I can assure you that this is a specialty that takes an extraordinarily amount of time to complete this certification or this level of surgeon status in the medical field because you're dealing with youth and their sensitive bodies and those bodies which have not developed fully as an adult would. They have to go through specialized training. And I would say that these uh, surgeons are being they're being trained on the job, off the job, in their free time, during their work time. The study never stops with them. I'm sure they're highly paid as well for their efforts. So thank you for the pediatric plastic surgeons out here. Your work definitely makes an imprint on our society. Some of the more minor conditions we treat include ear malformations, deformities, skin tags, moles, lumps and bumps, and head shape anomalies. The most common reason we see kids is for concern about their head shape. While the Back to Sleep campaign has reduced the incidence of sudden infant death syndrome, it has led to a dramatic increase in the frequency of abnormal head shapes. That's powerful. I mean, just to think about it, as a parent who is of considerable age, 16 years or above, every day that you have slept, for the most part, you have laid your head down somewhere. Now there may have been a few moments in time where you went to sleep and you were sitting down and you still drooped off and your head went to one side or the other or front to back. And as a child, your head was laying on a surface and no one can control how your head will shape. It's up to, I'm going to assume biology. This is a great assumption that I'm making on how your head is going to shape. And as he said, there has been a reduced incidence of sudden infant death syndrome. Yet the trade off is that doctors, these pediatric plastic surgeons, are having to do surgery to form or reshape abnormal heads. So this is pretty intense. This is a pretty intense topic, and I'm sure that though I've never actually heard of this before until I ran up on this article or was doing some research and I found this article. I said this article would be a great one to just discuss and see what people are with it, with this knowledge. Let's continue. Other very common conditions we treat are congenital hand or foot anomalies, often having an extra finger or toe or having multiple digits connected to each other. I've seen that before with a young guy I grew up with. One of my peers, he had an extra finger, and I believe he had that extra finger removed. Um, I've also seen adults who had toes. I've seen people with toes that are connected. So I've seen that before. So that makes sense. And I never thought about what type of doctor practice or what type of medical practice could fix that. Never crossed my mind because I mean I have 5 fingers, 5 toes. They're all separated. Still not perfect, but they're all separated. So that's never a lane that I had to look into to learn about this practice. But let's continue. There's a question. What differences in an ear might require a pediatric plastic surgeon? Answer. Ear anomalies cover a wide spectrum, from being prominent on the mild end to completely absent on the severe end. Wow. The treatment depends on the condition. Prominent ears can be molded in infancy or surgically treated, otoplasty or ear pinning, at an older age, while an absent ear may require more involved surgery using cartilage. Wow. Uh, that's why, as humans in this society, we need to be conscious of how we treat each other because we never know what a person is dealing with. Not even on an emotional level, on a physical level, which can in turn be emotional to that person. We may not know that that person who may be making an ear joke, ear quip, and may not know that that person has had surgery on the ear because of a deformity from birth. So let's be conscious of each other and empathize with each other. It's all good sometimes when we're having fun, but let's care for one another. Next question. What are some of the more complex conditions that require a pediatric plastic surgeon? Answer. These include craniosynostosis, in which the bones of the skull fuse prematurely, cleft lip, which we saw above, and palate, breast anomalies, and jaw problems, malocclusion. Those are areas I've never heard of, but I am providing this information because some people may have heard of them, and this may be an important issue for a viewer of this video to know about. Next question: what can be done for malocclusion, bad bite? Answer: the jaws can be moved surgically to be in a better position. There are 3 common reasons a patient may be a candidate for jaw surgery. Now, I always felt like something dealing with the jaw was something that a dentist would take care of. But I'm thinking about a person who actually has teeth. What about when a child doesn't have teeth and they have a jaw or mouth problem? That's an issue that most of us probably never thought about. Let's continue. Developmental. The upper and lower jaws grow in such a way that they don't meet properly or just aren't in the right place. This can lead to difficulty chewing, pain in the jaw joint and or muscles, unfavorable appearance, and sleep apnea. Next, malocclusion, caused by a medical syndrome or trauma. The most common syndrome associated with abnormal jaw growth is cleft lip and palate. Many patients with clefts ultimately require jaw surgery. Injuries to the jaw can also heal in poor position or disrupt future growth. I've seen cleft lips before, but never thought about, hey, medical field, what what practice in the medical field would tend to that. Let's continue. Breathing issues. This can occur in patients of any age, but is most common in infants or adults. In infants, breathing issues that may require jaw surgery are typically caused by the lower jaw being underdeveloped. In adults, weight gain is often involved. especially if the patient has a relatively small jaw. Soft tissue can crowd the throat, narrowing the airway and ultimately cause obstructive sleep apnea. I've heard of sleep apnea causing problems for adults, and adults, when it's severe, have to have surgery. Yet I never thought about it for young people, and I'm sure if I'm saying this, there are a lot of people who never give it a thought. But this practice for pediatric plastic surgery exists for families who deal with this. So, as a father, if your child is dealing with one of these medical issues, I'm going to say don't fret, because while you are dealing with it emotionally and physically, there are doctors in place who have studied, who have trained, and are prepared to at least educate you on the issue. And then, if there's a way to fix the issue, their training should allow them to fix the issue. Just another tool in an arsenal for a father, so that he can be some support to his child. Let his child know, hey, we know that we're dealing with this, but this is an area of growth for you, my child, because you're going to meet a person and you're going to be involved in a discipline that most won't know about, and it can actually set this child apart as they grow older, and it actually makes them more intelligent in their conversations and in their dealings with people. Because this child, fathers, your child is talking to a doctor about a highly complex issue that they're dealing with. Let's continue. This can be treated by pulling the jaws forward, which takes the soft tissue of the throat with it, opening the airway. This is usually a cosmetically favorable change. Regardless of the complexity of a patient's condition, our experienced multidisciplinary team is equipped to provide compassionate, personalized care using innovative treating options. Now, I'm going to say this, as I've said on numerous articles. This gentleman or doctor is grifting, but this is a good grift right here. This is a good grift. And I appreciate this doctor for grifting. I appreciate this doctor for going to school and trying to sell his, or I don't know if it's a woman, but man or woman, but it's trying to make an attempt to sell his or her services, as well as put their hospital on a pedestal. I appreciate that. That's awesome. You bring a lot of acclaim to this hospital, Dr. John Smetana. Children's Health is a continuing series. Dr. John Smetana is a pediatric plastic surgeon practicing at Advocate Children's Hospital. Visit advocatechildren's.com/services/plastic surgery for more information. This was actually a great article. Um, I appreciate Dr. John Smetana for taking the time to talk to us about what an adolescent plastic surgeon does. Because it's not every day that us living in society, and particularly us dads, get a chance to learn about this field. Thank you all so much. Once again, Happy New Year. And this is Raising.A.Dad.Solutions. I'm Robert, and I'm back talking to fathers about learning about what benefits your child, what you can do for your child to develop your child, and also learning about a field such as this. And if your child is of age to have a conversation about it, they may have a friend who's dealing with it, and you can help your child empathize with what their friend or classmate or peer is going through. Thank you so much. Have a good day.